So if you take a scalpel, right, and you create two identical incisions on two perfectly healthy people, one of those wounds will routinely take like a full 24 hours longer to close up and restore its skin barrier.
Which is wild when you think about it.
Right. And the difference between those two healing timelines, it isn't their diet. It isn't their genetics. It certainly isn't, the quality of the bandages or the sterility of the room or even the precision of the surgical technique.
No, not at all.
The single variable dictating how fast those cellular structures knit themselves back together is completely invisible, and it is entirely reliant on what happens when the patient is unconscious. So, welcome to today's deep dive.
Glad to be here.
We are taking a massive stack of provided clinical data, immunological studies, and sleep architecture mechanics to answer a question that seems incredibly straightforward but is biologically profound. Can poor sleep affect tissue repair after medical treatment?
And, well, to answer that for you, we really have to fundamentally re-examine what the body is actually doing when the conscious mind just shuts off. My role today is to synthesize the cellular mechanics behind this whole process.
Because it's a lot to unpack.
It really is. We are going to map out exactly how a lack of sleep alters your body's ability to repair itself. And not just on a macro level of, feeling tired, but right down to the transcription of your genes and the behavior of your immune cells.
Right.
We need to look at the aggressive chemistry of what happens when you close your eyes.
Yeah, we have to completely discard the idea that sleep is this passive state. It is not a biological standby mode. You aren't just powering down the laptop to save battery, right?
I love that analogy. Yeah, that architecture of human sleep involves this intense, highly orchestrated physiological activity, specifically when you drop into non-REM stages 3 and 4.
Which we know is slow-wave sleep or deep sleep, right?
Exactly. And 70% of all physical rest and actual tissue proliferation happens in this specific window.
70%. That is massive.
It is. When your brain activity transitions into those slow delta waves, your body basically goes into absolute overdrive. The neuroendocrine system essentially flips a switch, and the most critical consequence of that switch is the massive release of growth hormone.
Right.
The highest systemic concentrations of growth hormone you will experience in a 24-hour cycle happen right here. It acts as the biological foreman of your tissue repair. Growth hormone travels to the liver, stimulates the production of insulin-like growth factor 1, and that complex is what actually drives the heavy machinery of healing.
So it's basically like a biological construction site night shift.
That is exactly what it is.
Like when the conscious brain shuts down and gets out of the way, the body brings in the heavy machinery. It's directing the cells to accelerate reproduction, laying down the scaffolding, which is the collagen, and laying down the plumbing, right? The new blood vessels piping fresh blood directly into the newly forming tissue.
Spot on. And there is a highly counterintuitive detail in the clinical data regarding growth hormone that illustrates just how specific this mechanism is.
Oh yeah, the synthetic hormone study.
Yes. If you take a perfectly healthy person with a minor cut and inject them with synthetic growth hormone, their wound doesn't close any faster.
Wait, really? It doesn't speed things up at all?
Not at all. The baseline physiology is already operating at peak efficiency. Flooding it with artificial hormones doesn't just magically speed up the assembly line, but you see a completely different biological reality in a catabolic or morbid state.
Like recovering from a severe third-degree burn or surviving a massive trauma surgery.
Precisely. In those extreme states, the body's resources are entirely depleted. The metabolic demand is astronomical. Under that level of trauma, the naturally released nocturnal growth hormone transitions from being just a routine maintenance worker to being the absolute linchpin of your survival.
Wow.
Yeah, without that specific slow-wave sleep triggering that specific hormonal cascade, the structural regeneration of the tissue essentially just stalls out.
Which, that forces us to look at the immediate biochemical fallout of keeping those biological construction workers awake.
Mm-hmm.
We have to map out the immune response to sleep deprivation.
We do.
Because the sources show that the moment you disrupt that slow-wave architecture, your endocrine system registers a threat. And that leads to an immediate, sustained spike in cortisol.
Right. And cortisol is our primary stress hormone. Its mechanisms in wound healing are just devastating if they aren't carefully controlled. We know cortisol is an immunosuppressant, but the how is what really matters here.
Right. How does it actually suppress it?
Well, cortisol physically downregulates the expression of receptors on your white blood cells. It literally prevents the proliferation of T cells and severely blunts the production of the early inflammatory cytokines.
So it's essentially blinding your first responders.
Ex-
Because in the initial stages of wound healing, you absolutely require an aggressive, localized inflammatory response to rush macrophages to the site, clear out necrotic cells, and basically prepare the tissue bed for new growth. If high systemic cortisol delays that initial clearing process, the entire timeline of cellular regeneration just gets pushed back.
Yeah, and compounding that delay is the activation of the NF-kappa B transcription control pathway.
Oh, this part was fascinating.
It's wild. When you are sleep deprived, this molecular switch translocates to the nucleus of your cells and starts turning on pro-inflammatory genes. But it isn't creating the acute, localized inflammation you need at the wound site. It creates a state of systemic, low-grade inflammation just circulating in your blood.
And there is a crazy physiological anomaly in the data regarding that NF-kappa B pathway. When researchers subjected healthy adults to partial night sleep deprivation, they found this massive systemic NF-kappa B activation occurred significantly in the female subjects.
So completely bypass the males.
Yeah, it just completely bypassed them. It's a stark reminder of how deeply interconnected biological sex, sleep architecture, and immune function really are, and how much of that map we are still trying to figure out.
Absolutely. And to see how these cellular disruptions manifest physically, we can look at the blister study.
Oh, the blister study is brutal.
It is. Researchers took healthy adult volunteers and restricted them to just 2 hours of sleep a night for 3 consecutive days.
Just 2 hours.
Yeah, 2 hours. And then they used a suction device to deliberately remove the top layer of the epidermis on their forearms, creating these uniform controlled wounds.
And they track the healing process by measuring transepidermal water loss.
Yeah.
Right. Essentially calculating how much moisture was escaping through the compromised tissue to determine exactly when the skin barrier was fully restored.
Correct. And the sleep-deprived group saw their barrier restoration delayed by nearly a full 24 hours compared to the control group who maintained normal sleep cycles.
But wait, let me jump in with a pushback here. Because if we isolate sleep as just one variable in a complex metabolic equation, I have to question the finality of that delay. What if you supply the body with a massive surplus of the necessary chemical precursors?
Like a nutritional intervention.
Exactly. Let's say you flood the system with targeted amino acids, arginine, vitamin C, omega-3s, and zinc. Get a perfectly calibrated, hyper-aggressive nutritional drink, just override the biological deficit of a bad night of sleep? Shouldn't a good diet outmuscle bad sleep?
It's a great question, and the researchers asked that exact same thing. They gave a subset of those sleep-deprived volunteers a specialized nutritional beverage loaded with those exact structural building blocks. They wanted to know if you could essentially out-metabolize sleep loss.
And what happened?
Well, when they extracted and tested the fluid directly from inside the wounds of the people who drank the supplement, they found significantly higher concentrations of local pro-inflammatory cytokines. So the nutritional interventions successfully forced the immune system to work harder at the site of the injury.
Okay, but did it actually accelerate the closing of the wound barrier?
It failed completely.
Wow.
Yeah, the actual skin barrier recovery time remained delayed by a full day. The elevated immune activity in the wound fluid did not translate to faster structural repair. You cannot simply drink a protein shake or swallow a handful of targeted supplements to bypass the biological requirement for slow-wave sleep.
Because the workers aren't there?
Exactly. You can deliver all the premium bricks and mortar you want to the site, but if the workers haven't been signaled to clock in by the brain descending into deep sleep, the building does not get built.
Which creates this brutal, almost cruel irony for patients. Because the moment you suffer a catastrophic injury or undergo a major surgery, which is the exact moment your survival depends on uninterrupted slow-wave sleep to trigger tissue repair, you are placed in a hospital.
Right.
And the intensive care unit is arguably the single most hostile environment on Earth for human sleep architecture.
Oh, the environmental factors alone are catastrophic. You have continuous, unpredictable acoustic disruptions, monitors alarming, and bright, full-spectrum lights triggering your circadian receptors at literally all hours.
Awful.
But the environmental hostility is secondary to the physiological assault. You are dealing with the lingering neurochemical aftereffects of general anesthesia combined with heavy opioid administration, both of which aggressively fragment your natural sleep cycling and prevent that sustained descent into the delta wave stages.
Which traps the patient in what the medical literature refers to as the bidirectional relationship between pain and sleep. I like to think of it as a biological feedback loop from hell.
That is a very accurate description. It's a vicious, self-sustaining cycle. You have a massive surgical incision that is heavily innervated, firing pain signals up the spinal cord. Those nociceptors keep the reticular activating system in the brainstem hyper-alert. The brain basically refuses to power down into vulnerable deep sleep because it perceives a constant, massive physical threat.
Right. And because the brain is locked out of deep sleep, the production of growth hormone just halts. Collagen synthesis drops. The inflammatory clearing phase is prolonged. The wound literally stays open, raw, and inflamed for a longer period.
It gets worse because sleep deprivation fundamentally alters the central nervous system's pain threshold. It sensitizes your neurological pathways, meaning the exact same physical wound actually feels exponentially more excruciating the less you sleep.
So the surgical wound causes pain, the pain prevents sleep, the lack of sleep stalls the cellular healing and lowers your pain tolerance, which makes the wound feel even worse and heal even slower.
Exactly. And we aren't just theorizing about this loop. The scale of the destruction is fully documented. When researchers conducted a massive systemic review of over 10,000 surgical patients, the data revealed something astonishing.
10,000 patients is a huge sample size.
It is, and it wasn't the size of the initial incision, the duration of the surgery, or the specific surgical technique that predicted severe, acute post-operative pain.
It wasn't.
No. The absolute strongest predictive factor for uncontrollable acute pain immediately following surgery was the presence of sleep problems leading up to and right after the procedure.
That is incredible.
And the neurological consequences of that disruption don't simply vanish when the incision finally scars over and the patient is discharged. That same massive data set showed that severe sleep fragmentation during the acute surgical recovery window is a primary catalyst for developing chronic neuropathic pain years down the line.
Wow. Because the central nervous system essentially gets stuck in that heightened, sensitized state.
Exactly, because it was never given the biological permission to initiate the cellular repair sequence and calm down.
So the natural medical instinct when confronted with a patient trapped in this hypervigilant pain loop is to aggressively break the cycle, right? The standard protocol is usually to reach for chemical intervention, like prescribing potent sedatives or anti-anxiety medications to forcefully shut the patient's brain down.
Which makes sense on the surface.
But when we look at the chemistry of how those drugs interact with wound repair, we run headfirst into a massive complication.
Yes, you are talking about the benzodiazepine paradox, which is most starkly documented in trauma and burn units. Burn patients endure a level of psychological terror and physical trauma that is almost beyond comprehension. To manage that immense stress, doctors routinely deploy benzodiazepines.
Right.
Statistics from a 2001 study showed that over 77% of burn patients were prescribed drugs like midazolam to treat anxiety and induce unconsciousness.
But the critical distinction we have to make here is the vast neurological chasm between drug-induced sedation and actual restorative sleep.
Yeah.
Because from the outside, a sedated patient and a sleeping patient look identical, right? They're both lying still with their eyes closed.
Right, but chemically, they are experiencing complete opposites. Benzodiazepines operate primarily on the GABAergic system in the brain. They're incredibly efficient at decreasing sleep latency. I mean, they knock you out rapidly.
Yeah.
But chronic administration of these drugs chemically bulldozes your natural sleep architecture. They severely inhibit REM sleep, and more importantly for our discussion, they drastically suppress the slow-wave deep sleep where the growth hormone release and cellular repair mechanisms are actually housed.
And we can see the disastrous downstream effects of this chemical suppression in the animal models. When researchers administered midazolam to mice suffering from burn injuries, they documented a sudden, precipitous drop in vital inflammatory mediators.
Yes. Specifically, they saw significant decreases in the cytokines IL-1 beta, TNF-alpha, and IL-6.
Okay, so dropping those sounds bad, but what do those cytokines actually do in a healthy scenario?
Great question. So in a healthy wound response, IL-1 beta and TNF-alpha trigger vasodilation and increase vascular permeability. They literally loosen the tight junctions in your blood vessels so that neutrophils and macrophages can slip through the vascular walls and dive into the damaged tissue to start clearing the wreckage.
Oh, I see. So when midazolam drastically suppresses those specific cytokines, the blood vessels remain tightly sealed. The physical gateway for the immune system stays shut.
Exactly. The first responders are circulating in the blood, but they can't access the site of the trauma.
So, by trying to calm the patient's mind with a pill, we might accidentally be altering the deep sleep needed to run the physical repair crew.
Yes. And this leads to the dominant hypothesis emerging from the immunological data. The question is this immune paralysis a primary direct chemical side effect of the benzodiazepine interacting with the white blood cells? Or is it a secondary downstream effect?
And the evidence strongly points to the secondary effect, right? The midazolam isn't directly attacking the wound or poisoning the macrophages. The drug is chemically destroying the intricate cyclical progression of the natural sleep architecture.
Spot on. And because that delicate neurochemical environment is bulldozed, the immune system never receives the biological signals it relies on to choreograph the repair sequence. You are effectively disabling the software that runs the healing hardware.
That is terrifying. It highlights just how profoundly fragile human sleep architecture is, and how easily our medical interventions can inadvertently sabotage the exact physiological processes we are trying to save.
It really does. But, this biological reliance on slow-wave sleep isn't just limited to catastrophic trauma wards. The underlying mechanics of cellular regeneration remain identical, whether your body is trying to knit together a 10-inch surgical incision or repair the microscopic muscle tears from a heavy workout.
So we see these same exact physiological delays in the general non-trauma population too.
Absolutely. There is a highly revealing population study out of the Netherlands that tracked over 2,000 young adults, specifically university students. Researchers utilized standardized, heavily validated questionnaires to assess their baseline sleep architecture and cross-reference that with their perceived immune functioning and their recent history of minor injuries.
They were basically looking for correlations between everyday insomnia and everyday healing.
Exactly. And the correlation they found was massive. The students who self-reported struggling with slow healing wounds or minor lingering wound infections also reported drastically lower subjective immune function.
Wow.
But the critical data point was that this same group screened positive for clinical insomnia complaints and severe daytime fatigue at vastly higher rates than the control group.
So even in young, otherwise healthy subjects with robust metabolic baselines, a fragmented sleep cycle directly correlated to an inability to efficiently close and clear a simple tissue disruption.
Yes. If the biological demand for deep sleep is this absolute, then we have to aggressively protect the environment that allows the brain to descend into those slow-wave stages. For anyone heading into a minor procedure, dealing with a sports injury, or just trying to optimize their cellular recovery, the clinical data provides very rigid, actionable protocols.
All right, let's talk about those practical steps to protect the sleep healing environment, because the sources are very clear on this.
They are. The first physiological requirement is core body temperature manipulation. You must maintain a sleeping environment between roughly 60 and 67 degrees Fahrenheit.
Why so cold?
Well, to initiate the onset of deep sleep, your body has to rapidly vasodilate the blood vessels in your extremities to dump heat and drop your core temperature. If the ambient room temperature is too high, that heat transfer is blocked, the core temperature remains elevated, and the brain is prevented from sinking into slow-wave sleep.
Okay, that makes total sense. You also have to ruthlessly eliminate sensory intrusion. Total light blockage and consistent non-pattern noise control aren't just comfort preferences, they are shields. You are attempting to protect the reticular activating system from any external stimuli that might trigger a threat response and rip the brain out of the delta wave stages.
Exactly. Furthermore, the timing of your sleep must be violently consistent. The neuroendocrine system doesn't operate randomly. The massive pulsatile release of growth hormone is tightly coupled to your natural circadian rhythms. If you are constantly shifting your sleep window, you are essentially misaligning your biological clock with the hormonal assembly line. What the data fundamentally demands is a total paradigm shift in how we view recovery. We have to start treating sleep hygiene with the exact same unyielding medical rigor that we apply to sterilizing surgical instruments or adhering to a course of heavy antibiotics. It is the primary biological shield against delayed cellular regeneration and prolonged infection.
The overarching reality we have uncovered today is that sleep is an incredibly aggressive, active biological treatment. It is the designated time when your endocrine system deploys its heaviest machinery, when your protein structures are furiously rebuilt, and when your immune system wages war to protect your compromised barriers.
Yes.
You cannot out-eat a lack of sleep with supplements, and you must be incredibly cautious not to chemically bulldoze the fragile neurological architecture that your immune cells rely on for their instructions.
And You know, if our circadian rhythms, our core body temperatures, and our descent into slow-wave delta sleep are this intimately physically hardwired into how our tissue stitches itself back together, it forces us to reevaluate modern recovery.
How so?
Well, we live in a society that is constantly fracturing its circadian biology with shift work, digital light intrusion, and chronic low-grade stress. It begs a serious, provocative question about the future of medical treatment.
I'm listening.
Will we eventually reach a point where doctors prescribe and monitor strictly enforced, technologically isolated sleep schedules with the exact same gravity and frequency as they prescribe pharmaceuticals today? If sleep is the primary driver of healing, maybe we need to start prescribing it like a drug.
That is a profound shift in how we define what it actually means to rest and recover. Definitely something for all of us to mull over. We want to thank you for joining us on this deep dive. Take this mechanical knowledge, protect your sleep environment, and most importantly, allow your body to put those invisible tools to work tonight. We'll see you next time.